Good morning. Happy Monday, everybody. I hope y'all had a great weekend. Oh my gosh, the wind out here in Santa Clarita is kicking today. So those Santa Anas are blowing, so everybody remember, drink your water because you will get dehydrated in like 30 seconds walking outside of your house. That wind blows and just like you're going to turn into a pillar of salt. So 3 liters a day, pregnant people. That's not what we're talking about today though. So we're going to go over home birth. We talk a lot about what it's like to have a baby out of the hospital. We often talk a lot about how we're an accredited birth center and we have all this stuff. But we also do home births, and many midwives in the state of California will do both. They'll do home and birth centers. Some only do home and some only do birth center. So here at the Santa Clarita Birth Center, we do both. So we had a very exciting weekend. And we had 3 babies born this weekend, which was, I think, thanks to that lovely thunderstorm that we had on Friday night, which was very unexpected. I think it did kick in some labors. I don't know how the other midwives did over the weekend, but we certainly were very busy. So I am about to restock my home birth bag, and I thought this would be a good opportunity for those of you that are considering out of hospital birth, or you have questions about what does it look like? What do we bring to a home birth? How could it possibly be safe? Where's all the emergency equipment? And thankfully, we have everything to be safe in an out of hospital setting as long as we remain low risk. One of the births we had this weekend, actually, we did transport both the mother and the baby after the baby was born. Because the baby needed some extra respiratory support. The baby was breathing when she was born, thankfully, but she just was having a really hard time. She was very wet and probably some meconium aspiration. There was a bit of meconium, which is the baby's poop. After the baby was born, there was, some gunky poop in there. So we had to do some respiratory support. And what that looks like is we are trained as midwives in the state of California. We are trained in what's called neonatal resuscitation, NRP. We're also trained in basic life support, advanced life support and obstetrics, and all of those other skills that we would use if mom was having a hard time, and all the emergency skills that we're trained in. But neonatal resuscitation is very specific training. And so this yoga bag here, because we are midwives, so we still have to be sort of hippied out, is an oxygen tank. And this oxygen tank, usually at all times, is full of oxygen. So we bring this to our births, and at one of the births this weekend, we needed this tank. We needed to give mom some oxygen during the labor, and then we needed to give baby oxygen until we decided that it would be an appropriate time to take the baby to the hospital, which is what we did. So I'm going to go over what this looks like. So one thing is every home birth midwife will have an oxygen tank. They will have varying sizes of oxygen tank. I happen to carry a really big one. Some carry, smaller ones, which is totally adequate. I just happen to be carrying these big guys, and I always forget what number this is or letter this is, like a C tank or a D tank or something. But this has about, probably has about 2.5 hours worth of oxygen in it, and we run it at 10 liters. So this tank will last us quite a long time. Usually a tank will last me a couple of years because we rarely use it. But when you need it, this is what it's here for. So we have this big old tank, and then we have our emergency equipment that goes along with that tank. So this is called an ambu bag, and this is what we give positive pressure with. So in our NRP training, we know that if a baby's heart rate is low, or they're not ventilating well, they're not breathing well when they're born, we know how to give positive pressure ventilation with room air. And then if we get into, we feel like we need to give this baby some more supplemental O2, we have the tubing that attaches, which might have gotten left at the birth. The tubing that attaches to this, which will then go to our oxygen tank to give us some additional oxygen, so we can always be ready for the baby. So this is called an ambu bag, and we are trained how to use it, and that goes with our oxygen tank. And this is just a maternal mask in the event mom needs a little bit of supplemental oxygen while she's pushing. Often in the hospitals, many women will be given oxygen during the pushing phase, just to give that baby an extra boost of O2 via mom's breathing. And yeah, so we have it. And so sometimes we will use this for mom to give her a little bit of extra energy while she is pushing. So that's our emergency equipment over there. We also have some other things like an advanced airway. It's called an LMA, that if we were in big, deep trouble and we needed to really ventilate this baby with continuous positive pressure ventilation, we have the ability to intubate a baby with this really soft instrument that we can put into the baby's mouth and then connect to our oxygen. Thankfully, we've never had to use that before. And if we have to get to that point, we would have already called emergency services. So there you go. So I'm going to go over what the normal birth bag looks like. So here at the birth center, you've probably seen us set up before, but we have a tray that has all of our delivery equipment. We have the same thing in a home birth bag. We have the tray already set up and ready for delivery. And it has all the things we need to do vitals. So every midwife that is doing an out-of-hospital birth will, of course, come into your home, and she will get a set of vitals on you. She's going to check your blood pressure. So I haven't gone through my bag since that birth the other day. She's going to check your blood pressure. She's going to check your temperature. And they are also going to listen to your baby's heartbeat. So we have an awesome fancy Doppler. And because I'm such an A-type personality and I like to have everything I need and extra, I also carry a second Doppler. Just in case my first Doppler gives me a hard time, I always carry a second Doppler. And both of these Dopplers are waterproof, so we can use these Dopplers just like at the birth center. They can be submerged in the water, so you don't have to be on the bed or outside of the water. You can be in the shower, you can be in the tub. And many of our families will either buy an inflatable birth tub or borrow one from us. We don't charge for our inflatable tubs, we just lend them out. Because usually people have blessed us and given us tubs, so we are happy to pay that forward and let you borrow a tub as well if we have one available. So it's quite simple to set up a birth tub at your home, and we go over all those details before your baby's born. But both of these Dopplers are waterproof, so we always carry two, we always have an extra. So there's our Doppler. And then we also have in addition to our oxygen in case we need it, but before the baby's, or after the baby is born, if mom has an emergency and she's bleeding, we carry two types of medications to our home births. At the birth center, we have three types of medications. One of them has to be refrigerated, so we don't bring it to our home births because I don't have a cooler bag inside of my birth bags, and so I don't carry it with me. But I do carry Pitocin, which would never ever be used before a baby is born. We would only use Pitocin after the baby is born. And in this situation, one of the births over the weekend, we needed to use some Pitocin after the baby was born because in addition to having to help this baby a little bit, the mother's placenta decided not to be delivered, which is not uncommon. After a baby is born, normally baby goes skin to skin on mom. The room is warm, there's lots of oxytocin, the baby's doing great, and the baby does that normal transition. Mom's oxytocin level is quite high still, so her uterus is contracting. She has a normal physiological third stage of labor, meaning the placenta will just automatically, as the uterus is contracting, slide off the uterine wall. She'll have what we call a separation gush, so we'll see a little bit of red blood, and then we'll know, oh, the placenta's ready, and then usually within 30 minutes or so, that placenta is easily just pushed out of mom's body, and then we are on to the fourth stage of labor, which is basically the recovery stage. But often, if a baby is having a hard time and we're paying lots of attention to the baby and we're stimulating and we're breathing and we're doing some resuscitative efforts to a baby, mom, of course, her brain chemistry shifts, right? She's focused on her baby and she's no longer producing all that lovely, yummy oxytocin, even though if we have to help your baby with breathing at all, we're going to do that on your body. We actually use this tray, right? This is my delivery tray, and this is the cover. We use this as our firm surface. So we will first put the baby skin to skin on mom, and if this baby needs any breathing efforts, we will just flip the baby on mom's body while the baby is still attached to the cord and do some breathing for the baby. If we're having a hard time getting good ventilation, because sometimes it's positional for the baby where it's hard to get that airway open when the baby's scrunched on mom, we'll just take this tray and put it on mom. So she is still holding her baby. tray is nice and firm, so we can get that baby on its back, still attached to the umbilical cord, so the baby's getting oxygen from the cord, and then we could do our resuscitative efforts on top of our tray, which is on top of the mother. But she's still not super happy about that, right? So her oxytocin levels drop, so her uterus does not continue to contract, and therefore that placenta may not come off the uterine wall. And that was the case in this situation. So we gave her a little bit of Pitocin to try to get some contractions going. And then we stopped fussing with the placenta and focused more on the baby. Baby was stable, and mom still did not deliver her placenta. So we all went to the hospital together, and then the placenta delivered uneventfully, and then the baby resolved, and baby's doing great. So we do have Pitocin, and then we have another drug in here called misoprostol, which is also called Cytotec. It's super duper powerful stuff, and that's another mechanism to help the mother stop bleeding if that were the case after the baby's born. So both of these are for that third stage if mom is bleeding or not delivering her placenta. So we have these medications with us, and we keep them right in here. And we have a stethoscope. This is a neonatal little, this is an infant stethoscope. So in addition to breathing for the baby, we're also listening as soon as the baby's born. We're listening for what's called bilateral breath sounds. We're listening for the heart rate. And these are ways that we can assess how well the baby is doing after the baby's out of your body. That's that. And then we have just of our regular, gloves and gauze and non-sterile gloves and some gel. And we have a catheter in case you can't get the pee out. We have a bladder catheter, and these are also called red robins or in and out. So this little red robin here, we use these itty bitty teeny tiny pediatric catheters because nobody wants a big old tube getting stuck into their urethra because it can be a little bit uncomfortable, and of course our moms are not medicated. So we use these little itty bitties so you can't really feel them going in. The downside is that it takes a little bit longer to get all the pee out, but let me tell you, it does the trick. And it's less uncomfortable, and we rarely ever get anybody with a UTI after they've been catheterized. So we keep 2 of these in here as well. We have this other thing that I used while we were at the home birth, but let me see if I have one in here. It's called a Deli, and it's a suction device. And so I don't have one in, I have to replace it. So we did suction this baby as well to try to get any of the gunk out. And then this is an amni hook. We rarely use these guys. This would be to break somebody's water. And it's this little plastic hook, and it's got an itty bitty, teeny little tiny little poker on the end, like a little thorn from a rose bush. And that would go into the vagina up to where the bag of water is and snip, and that would break the bag of water. We rarely break bags, and often if we are going to break a bag of water, we could just do it, put a glove on, go in, pop it with our fingernail. Super simple. So that's what's in this delivery tray that we are going to restock today with our sterile gloves and our gauze, and I'm going to put a new Deli in here, and then we're going to restock it so that the next person that has a home birth, we just roll in with our little wheelie bag, pop it open, and we're ready automatically for a delivery. And then each of our moms will buy a birth kit, and that has all the disposable items that we use in here. Some midwives have more things, some midwives have less things. We try to keep that birth bag at a minimum. We try not to defer any cost to the client in terms of like the non-disposable stuff or the stuff that you would rarely use. So really what just comes in your kit is gauze, gloves, non-sterile gloves, and a bulb syringe that you're going to use at home, and some cord care stuff, the umbilical cord band, some golden seal, some things like that you're going to use before, during, and after the birth. So we roll in, we're ready to go. You have your birth bag on the side. We use all of our stuff, and then we restock with whatever disposable items came in your birth bag. So that's what that is. We also have IV fluids, right? Tubing. So in the event this is a big old bag of fluid. This is a liter of lactated ringers. This bag, in the event you're bleeding after the baby's born or you're vomiting throughout your labor and you just cannot stay hydrated by mouth, we may run a liter bag of fluid for you to help you out because we don't want you dehydrated in labor. More likely, we're going to use this liter bag of fluid after your baby's born if you were to bleed. We want to increase your blood volume, so we have 2-liter bags of fluid that we carry to all of our births. In addition to that, we have our antibiotics, and we keep a tray in here. So this baby also, over the weekend, that mom was GBS positive. Her group B status was positive, so she opted to have antibiotics in her labor, and so we have to restock as well. So we have small little bags of sodium chloride that we put your antibiotics in, and we carry 2 different types. We actually carry 3 different types of antibiotics, but one of them we don't use very often. But we carry 2 different types. If you're allergic to penicillin, we carry a second type. And then, yeah, so we got 2 different types of antibiotics that we keep in our bag at all times. And we have 24 hours of antibiotics in our bags at all times. And catheters and things like that. So this is for non-emergent use if you need antibiotics in labor. And it's a very personal choice. It's a pretty heated topic about whether or not we should be culturing all women for GBS, but we do here at our birth center, and we do offer antibiotics to everybody who needs them. We also have suturing. So if you tear, we can suture at your home. So we have all of our suturing equipment in here. We have our lidocaine, we have our suturing material, we have our suturing instruments, vitamin K for those people that are opting to give the baby vitamin K after the baby's born. We bring that with us to the birth as well. So we have our little vitamin K ampules and our filter needles and everything that you need to administer vitamin K if you're going to do the intramuscular injection. Some of our families, when they order their birth kit, will order oral vitamin K. And there is a protocol for that. It is not FDA approved in the United States, but we do talk about what that looks like. So, that's pretty much what we got here in our birth bag. And then we have miscellaneous like midwife stuff. We have some homeopathics, we have some herbs, we have extras of everything because, you know, we don't ever want to run out. And that's what that looks like. And then after the baby's born, of course, we have our scale and our measuring tape that we keep in there. And what's going to happen today is I'm going to go see 2 of the 3 babies that were born this weekend. And we're going to offer, just like they do in the hospital, and we've talked about this before, we do the critical cardiac heart defect check, right? So when you have a baby in the hospital, at the 24-hour mark before you're discharged, they put this little pulse oximeter on your baby's hand and on your baby's foot. And then you check how well your baby's oxygenating, how well that blood is oxygenating. So we're going to go to the home and do this critical cardiac heart defect check at their home. And we're also going to do what's called a newborn screening if those families are choosing to do that. And I believe that they probably both are. And that is a heel prick, right? That's that blood test that checks for, I think it's like 83 different metabolic, hemolytic, and endocrine disorders and some genetic disorders as well, such as cystic fibrosis. So we're going to do a poke on that baby's foot if they consent. And we have those little lancets in our bag. And it's this little poker thing. And we're going to poke the baby's foot. And we're going to draw some blood and put it on these cardboard things. And we're going to do our newborn screening. And this is what that thing looks like. And when this is done in the hospital, it was interesting. We were at a hospital, like I said. And the way they talk about these tests is they didn't say that you have an option to decline, right? There was no consent being given. It was like, we're going to give the baby erythromycin and vitamin K, and then we're going to do X, Y, and Z. And so I just reminded our family that although that language is being used, we are going to do X, Y, and Z, I reminded them that although they may choose to do those things, it was within their right to say no thank you. And that they always deserve, you always deserve informed decision-making and consent. So although some language in different settings may sound like you're being dictated to and that you don't have a choice, you always do have a choice. This is the newborn screening. It's a really great test. We support this state test. We think that we get a lot of really good information from it. You do have the right to decline it. But these little circles here, so we poke the baby's foot, and then we have to fill these 6 circles with blood that have to saturate the front and the back of this cardboard. And then it gets sent to the state of California, and they analyze this blood for a variety of disorders. And we've recently come up with some babies that have some disorders, so it's been super duper helpful. And so that will be done at the home visit as well. The one thing we do not do at a home visit, because we're not trained in it and I can't figure out how to get a machine for it, is a hearing test. And that is offered to you in the hospital after birth, before your discharge, after the 24-hour mark. Before 24 hours, their ears are filled with amniotic fluid, so you can't really do it. So it's after the 24-hour mark, the babies in the hospital will be given a hearing test if you consent. Unfortunately, we can't do those. And more unfortunately, our local hospital refuses to do those for our out-of-hospital born babies. And so unfortunately, we have no way for the babies born in Santa Clarita Valley to get a hearing test.
I got mine at the hospital.
Yeah, they stopped doing it. So we're working on that with the state on how we can get authorized to do the testing. But we haven't solved that hurdle. So right now, unfortunately, the babies born in the Santa Clarita Valley have no local place to go for their hearing tests. So again, unfortunately, this is covered by your insurance. It's a mandated test in the state of California. We just don't have a hospital that's willing to do them for our out-of-hospital born babies. So we have to send you to Burbank or somewhere, and we could get it done. It's just not that simple. So we're working on doing it ourselves, and we're in the process of trying to solve that, and we are discussing it with the state of California to try to figure out how we can serve our families better and make sure they're also getting the hearing test. So it's a little bit of a pet peeve of mine that we can't seem to get those done in Santa Clarita. So if anybody has any intel on that and can help us solve that problem, we would love it. So that's that. And then of course we carry our computer, so we're still doing all of our electronic charting. And that's what it looks like when you have a baby born at home. Everything that is here is put literally into this little wheelie bag and this lovely carry-on bag, and then my oxygen tank, and we have everything that we need. So I hope that's helpful, and maybe we'll dispel some fears about out-of-hospital birth and what do we do if there's an emergency. We carry all of this lovely equipment, and we are trained to use all of this lovely equipment. 99.9% of the time, this tank never gets used. That's why we've had it in our trunk for so long. We never have to open up our antibiotics, and we rarely have to use our IV fluids. We more likely will throw away our antibiotics because they expire before we use our antibiotics. So there you go. I hope that's helpful. And if you have any questions or concerns about out-of-hospital birth, this is pretty standard. So as far as I know, all my fantastic midwife friends we all carry the same gear. So anybody you meet should have all of this basic stuff. Some maybe don't do the pulse oximeter. Some maybe just refer out for the newborn screening, but this is standard licensed midwifery, certified nurse midwifery gear for anybody doing an out-of-hospital birth. So I hope that's helpful. If you have any questions, of course, you can always email us, call us, participate in a conversation below. We'd love to hear if you have any questions or concerns. And remember to drink water. Those Santa Anas are blowing, and we'll see you next week.